I'm Dr. Kudrimoti at Mercy San Juan Medical Center. Today on Ask the Expert, we're talking about epilepsy, what causes seizures, and how we help patients manage them safely. So what exactly is happening in the brain when someone experiences a seizure? Normally, when the brain cells are firing off, they're doing so in a very coordinated dance that helps us do what we do normally, such as speak or play an instrument. And what happens during a seizure in the brain is that there is a sudden, uncontrolled electrical discharge in the brain. Epilepsy is a neurological condition that is characterized by recurrent unprovoked seizures. So typically, if a patient has more than one seizure, they may have epilepsy. Not all seizures look the same. There are a few main types to know about. The first and the more common type is what we call a focal seizure, where one part of the brain has the abnormal electrical activity. The second main type is a generalized seizure, where the entire brain goes into the seizure all at once and often produces a convulsion. Very often, a focal seizure can spread rapidly to form a generalized seizure. Seizures have myriad manifestations. The more commonly recognized seizure is the convulsion or the grand mal seizure, but the less recognized seizures with more subtle signs, a metallic taste in the mouth, smelling a weird, unpleasant odor out of nowhere. The patient may be witness to stare off into space and have involuntary movements. Epilepsy remains primarily a clinical diagnosis. When patients report episodes to us, we listen carefully and are able to make a diagnosis of seizures and epilepsy based on that report or the report of family members or friends who may have witnessed the episode. We do, however, need to obtain two tests that are really important in diagnosing epilepsy. One is the EEG, or electroencephalogram, which is basically a brainwave test. And the second test, brain MRI, uses non-invasive technology to produce refined pictures of the brain that help us detect abnormalities that might help us understand why a patient is having seizures. For more complex cases, we use advanced monitoring in our epilepsy unit to guide care. Here at Dignity Health, we have a very comprehensive set of treatments for individuals with epilepsy. Once they're diagnosed, they're referred to an epileptologist like me. We see them frequently in clinic, and then we continue to monitor them closely so that we are more sure that they're not having seizures. Now, if they continue to have seizures, then we bring in more advanced testing. The patient is monitored on a video camera while at the same time we're recording their brain waves, and that helps tell us where the seizures are coming from the brain and what we can do about it. Once diagnosed, the goal of treatment is simple: helping patients live seizure-free. The primary goal of treatment of a patient with epilepsy is clearly to control their seizures, but there's a secondary goal of treatment, and an equally important one, and that is to maintain and improve quality of life. As you can imagine, having seizures has a very negative effect on patients' lives, and that includes severe anxiety from the unpredictability of seizures, losing their driving and work privileges because of seizures. Here at Dignity Health, we offer the most comprehensive and compassionate care for patients with epilepsy. Epilepsy is manageable with the right care and support. If you or someone you know has had a seizure, don't ignore it. Getting the right diagnosis is the first step towards effective treatment. We hope this conversation has provided a clearer understanding of seizures and how they're managed.